What is your dental routine on a daily? We're here learning a lot of new things, and some of us have not even been practicing any of it. You know, in most cases, when it comes to health talks, sometimes you fall victim and you feel like you really need to learn more and more and more. And still on the issue of dental healthcare awareness with Dr. Juliet here. We are rolling, I would say. We are still going. We are learning more and more as we are driving your business. And it's one of the businesses that you can definitely venture in. If I told you a doctor, if I told you a dentist, we have, I think we have medical students doing dentistry.
Very. And speaking about a business venture you can consider actually there, should one consider it as a business venture anyways?
Yes, please do. That is a sign of success. If you're not a dentist and you are looking at investing in a dental clinic, this is the way to do it. Please do it, please, for the sake of everybody.
Okay.
Because if the dental structure to have a dental practice, it has to be owned officially by a dentist. But the dentist can have a company that owns practice.
Okay.
So you can own shares in that company as if you're not a dentist. So if you own shares, meaning you can easily watch the quality of the dentist, the dentistry being practiced. You will know exactly what they are putting in because you demand for that information as a shareholder. So you'll be improving health like too much. If we could get more investors looking into this system, even like dentistry, as dentists themselves, dentistry grows as a practice. There are so many things that have come up that people here in Africa, we have not got to know. Okay. Just because dentists don't have the money to go abroad and find these researchers to teach them or show them how these things are done. But if we had investors who are interested in the business, your business being the dentists themselves, you can easily give them like that up. You can give them that money to go abroad, study first, get experience, even have these, exchange visits. Like you go to Canada, you work in a dental clinic there for like a week or two, understand how it's done in Canada, you come back. You could go to Malaysia as a dentist, you're hosted by another business person who has clinics there. And that could help a lot in improving our dentistry here because it is a growing profession. It evolves. It's like evolution because as humans we are growing and we are changing, meaning that people who are treating us have to keep getting new information about us.
Okay, and as Sonko comes in, if you could share briefly, are there any challenges so far you have encountered here with pursuing dental care as a business? Oh. Just briefly.
Briefly, as a business, dentistry is expensive.
Okay.
So as personally, when I was returning to Uganda 2019, I opened a clinic. And I know the procedures of opening up a clinic and what you need. And with my money I had saved, all my savings, I opened up that clinic. But during COVID, I think many people lost their businesses. Mine was robbed and everything was taken. Okay. Meaning for a dental clinic that you can invest at least 200 if you want a class dental clinic, modern. I'm going to use a word that is new to your ears.
Please, we are ready. We have had a lot
of new things here.
There is something called squat dental clinic. A squat dental practice is...
You can only imagine. Anyway.
It's a practice that we are starting from scratch.
Okay.
That everything from the probe, which is the mirror we used to, and the mirror we used to check your mouth, is brand new. No second hand, because in dentistry it's popular to use second hand because it's expensive. But if we had health investors who really love their health, and you're not going to let something second hand that has been used some million years in some other countries to be used in your mouth, and we invest in something that is brand, like first used on our patients here, which is called squat. That's squat practice that we need to encourage investors to put in money. You get the modern dental chair, get the modern decontamination system. If anything, Corona has taught us that if you don't if you don't sterilize your area, you can easily get sick. And then also we get better quality dentists.
Now let's look at besides the dental squat and all, let's look at the teeth guards.
Yeah.
These are innovations that have been on here.
Yeah.
In most cases, you'll find a number of Ugandans lately having them in their teeth. How effective are they? And how much do they cost?
Okay. Yes, when it comes to teeth, like braces and the teeth guards, that is something we call orthodontistry, which is more done by orthodontists. So,
who is an orthodontist?
Yes, this is someone who deals with correcting the arrangement of your teeth. Okay. Yes. So it so happens as humans, when we are growing, our jaws tend to shrink or expand.
True.
There are people when they were younger, they had a kazibo tiny, but as they are growing, it becomes being big, meaning their jaws are expanding, the kazigo is widening. There are people, when they were younger, they didn't have crooked teeth, but the more they grow, the teeth squeeze. They start having more squeezed.
I won't speak about it.
It's because sometimes the jaw is shrinking. We all different. So there is it's like, if that shouldn't be something we call it, that shouldn't be something to worry you. To have a malalignment. Of course, visit a dentist. There are many things that have been done. Personally, I have done a dental course that deals with aligning teeth in 6 months. It's called 6 Month Smile. It's not popular in Africa. It is only done in America and England. I was lucky I was working for high-end and I was able to be paid for to study it. So if we could bring more of those systems.
I might go to that six months. I might lose my smile from there.
Yes, and get a new smile and start smiling for any creature that comes in front of your face.
You just become smiling.
Yes.
Okay.
Yes, so it's there. And then the braces themselves, they need more education to be done for us. Because some people will blame like the dentists. They didn't tell me that the child needed what? Braces when they were young. But when someone was young, the teeth were what? Okay. So the only thing we can do is encourage parents to take their children for dental checkups when they are young. Because if it's noticed when you're young, it can be corrected. And your smile can be retained. Retention is, after they finish correcting your teeth, there is that wire they put behind your teeth to keep them like that. Even if your jaw is shrinking, your smile remains beautiful.
I think those are the wires we're talking about. How costly are they?
They are very expensive because it is stainless. It has to be in your mouth. You eat, you drink, there is air. So rust and all that is involved. So you need a quality product.
How long does it take for one to have them in their mouth?
So I put them, how long are they going to last in my mouth? You're laughing at us.
No, I'm used to this. Because, listen, okay, it's like when you're teaching a child to walk, and then they start walking, they want to go everywhere, explore everything.
Yes.
After they get to know walking is normal, they even don't want to walk, they want to be on the bed and be on fire. So that's the thing that happened here. What happened with these braces? As I told you, we are different.
Okay.
The way I grow is totally different from the way you grow. I could have them for a year, you could have them for 2 years. So that's why it's important to visit you. Your dentist will know you and will tell. Another thing, if you're working on places like here, you have to be in front of people. You might not be happy having metallic wires on your teeth. You might prefer something funny. Something different called ceramic. It is like, it looks like your tooth. If you're far away, someone will not even notice you have braces or wires on. So you can go with your normal activities and keep going to your dentist to check out your teeth.
Okay. And moving further onto the teeth and healthcare, is there any time to say that, okay, this is the late time? Is it ever too late to go for a dental checkup? Kick it from there, and also you jump in answering us here on maybe what should I ever know about to always visit a doctor? Like, when should I?
When should you, As I told you, the mouth is the opening of everything.
Okay.
And let me just tip this in. Your hair is to protect your scalp. So how often do you visit to take care of your hair?
When I'm going to a salon for a simple trim.
Which simple trim is not once a year.
Sure.
Twice a month.
Exactly. So if the mouth is more important than the hair, and as a request I'm making on Smart TV to all Ugandans out there, when you're making your plan, if God has helped you and you're alive by 1st January, The first appointment for you to make, my dear, is for a dentist.
Okay.
Because if you're sure your mouth is clean, you're sure your health is good. Ask me why.
Why?
First, your mouth is responsible for your chewing, your eating. Secondly, you want to know what you're eating. Is it affecting me or is it making me okay? You can't just keep taking in things and you don't know what it's doing to you. So some people, the way our diets are seriously eating away our enamels every day. Things like acidic drinks, Coca-Cola. People who like Coca-Cola a lot, please use a straw. Please use a straw. Please mukozese akaseke. Bakola akaseka akora nsonga. Coca-Cola omwetaaga ina kasukali mkoyetaaga mubiri gwo. Naye ate amannyo go gayinza obutamwetaaga kubanga sukali ayinza oba omungi. Kati instead of you putting all your mouth area to be happy with the Coca-Cola, it's better you put it direct where it's supposed to go, which is in your throat, in your body, somewhere else. So try to use a straw whenever you're taking things that are not only Coca-Cola. We have
we're going to give you an invoice, Julie.
All you people, we need to educate, especially if the beverages companies.
Yes,
Julie,
we could use beverages.
As we're trying to sum up this discussion now, just a minute, we want to know, is there exchanging of teeth for money? Or the tooth in dental? Like we've had stories of
tooth fairy.
People not only that, kidney. People's
I want money. Makes sense.
Transactions of kidney, their heart transplants. You've heard of all these.
Yes,
from
please.
the other angles.
Yes.
Has it happened in the dentistry?
Ugandans, the world. Don't worry. No one is coming for your teeth.
Okay.
Because the teeth grow once. And the teeth, we have only 2 layers of teeth in your whole life. We have what we call primary teeth. Those are the baby teeth that you come and you get when you're still young. When you lose them, there is what we call adult teeth. When you lose your adult tooth, nothing can be replaced there. If someone has lost their teeth and they're looking at your teeth, just laugh at them. They can never have them.
Okay. Then maybe, Sonko, just let me conclude here on this one. We have crossed with our toothbrushes from 2021 to 2022. I don't know if you have crossed with yours.
I bought one.
Someone could have, had a toothbrush for over 6 months.
Yes.
Is it of harm?
6 months is okay. But if it's 6 months and your toothbrush, have you looked at a toothbrush that is saying, sagala kusenya, sagala kusenya, sagala kusenya, sagala.
Okay.
If your toothbrush starts complaining, I am tired of brushing, meaning it's opening up, the bristles are going left, right, center, central. If you see your bristles are moving, please change it. Even if you just bought it yesterday.
Okay.
And the bristles are everywhere, please change, because those bristles are going to start traumatizing your gum. When you're brushing, these hard bristles are going to be poking your gum. Then later you're going to come with a red gum or bleeding. So try and watch the brush you're using. Also, it should be mild, not so hard, not so soft.
Okay.
Okay.
And, many thanks for joining us, Dr. Juliet. It's been a very, I would say, roller coaster ride when it comes to that situation. And Rita, any last ones?
Surely I am signing out for now, and Durham Postonko will be taking you through sport. You can catch me up at Rita Cabanero on social media platforms. Do you have handles? Yes, please. You can catch me on my social media, Msao Julie. That is YouTube. Please learn. There is a lot Luganda English, and also a Facebook, Instagram.
All right. Okay. Many thanks for joining in. This is Smart Means Business. Just a slight change of, I would say, simple break, and we'll be back with sports business. Stick around.